in HD with Brittany Williams and meteorologist Brian Walder. You are watching WVVA News at noon.
Welcome back, everyone. Joining us now is the former mayor of Bluefield, Craig Hammond, and Dr. Joseph Basin. He is a radiation oncologist, and they are both in today to help raise awareness about prostate cancer. It is Prostate Cancer Awareness Month. And Mr. Hammond, you are a survivor.
Yes, I am.
Yes. Thank you so much for coming in today to the both of you.
Thank you.
What can you tell us about your diagnosis? How did you learn about your prostate cancer?
Well, I'm the type of person that goes to the doctor about every 25 years. And my wife was really encouraging me to get a PSA test because my father had prostate cancer, my uncle, her brother-in-laws, and so she convinced me. I did, and it was an elevated amount, and so I started to learn about the disease and all the options, and that's how I wound up meeting Dr. Basin.
Dr. Basin, what are some of those risk factors? He was mentioning a few.
Right. The major risk factors are age, and another one is family history. So having a brother doubles your risk. Another one that's known is ethnicity. So African American men have a much higher risk of prostate cancer, as well as having a poorer outcome than Caucasian men.
Okay, now, Mr. Hammond, what kind of treatment did you receive?
I received radiation treatment after looking at all the options and where I was, and I just found that some of the best treatment in the mid-Atlantic states was right here in Princeton, West Virginia. So it was an easy decision for me.
That's great. And you were fortunate enough to be screened early.
Yes.
How important is early screening, Dr. Basin?
Well, since the advent of the PSA, we've seen about a 25% reduction in death from prostate cancer. So that tells you that's all straight from screening rather than other parts of this equation. So to me, it's clearly the biggest thing that you can do for your health as a man is to make sure that you get your prostate cancer screening. And it's important for women to nag their husbands to get their prostate cancer screening. So that's a doctor's orders right there.
Well, I can say that we are pretty good at nagging, typically. But it's for the better. Now, what would your advice be to anyone who maybe was recently diagnosed? I know they might be a little scared at this point.
Get screened early, talk to your primary care physician, have him order the PSA test, and then when it comes back, depending on what the results are, learn everything you can about it and the options for treatment.
Right. And plenty of questions will come up, I'm sure. Dr. Basin, how can our viewers get in touch with you if they have any questions?
Well, they can call our office. We're in Princeton near the hospital, 21st Century Oncology. The phone number is 425-1960.
Okay. Thank you to both of you for coming in today. I appreciate you coming in and for sharing your very personal story.
Thank you.
Thank you.
Yes, of course. And still to come on WVVA News.